if anybody online see the screen? All right, perfect. All right, so again, I'm Burton Hayden with Hercules Health Solutions. This is my brokerage. That's my contact information. I want to start off by just giving a little bit about myself, about my family, and who we are in the community. Originally, I'm from Gillette, Wyoming. So most people hear Wyoming, they think Yellowstone. I'm not from Yellowstone. I'm barely in Wyoming. It's actually more Montana-ish. But I was raised on a cattle ranch, similar to Yellowstone, and much like some of the things that happen on there, that is truly how lifestyle is, other than we don't take people to the railway when things aren't going our way, as far as you guys know. I'm married to my wife, Amanda. We've been married for 19 years. We have 2 children. I have a daughter, Emma, who's going to be a senior at Plano East here, technically kind of Murphy, Plano, East Plano area. She is the first lieutenant on her drill team, and that's pretty much what her life revolves around, is dance. She dances in school, she dances out of school, so that's pretty much what we do 24/7 around the house. My son is Dylan. He is 19. He is a multi-sport athlete, but he is going to be attending Louisiana Monroe this fall, and he's going to be running track on a scholarship there. So very exciting for him. We've been in Murphy since 2019. Ironically, we moved to Murphy and then COVID kind of hit, so we didn't really get to get out all that much and meet everybody, because we are still kind of in the transition phase, so we're trying to really take advantage of that now that things have opened back up. My background is actually, like everybody else, I grew up and wanted to be a health insurance broker from the day I was born. No, actually, I never ever even considered this job, and COVID actually kind of opened some doors for me and some opportunities. For the last 20 years, I've been a paramedic. I've worked everywhere from Las Vegas to Austin, Texas, back into Wyoming, Colorado, South Dakota, circled back down to Texas, and I've done everything from working on an ambulance to air medical and a helicopter and airplane. I've even spent about
recording in progress.
About 6 years in 2 different organizations as a SWAT medic. So I've been kind of an adrenaline junkie for most of my life, and that's been my background. In 2020, I was the director of education for a flight program, and what people don't really realize what happened with COVID is nobody was transported in ambulances, nobody was being flown anywhere, because nobody was really going to the hospitals, and the ones that were there were kind of staying there. That, in addition to the government shutdowns early on in 2020, my company actually closed their doors in August of 2020. So middle of 2020, and I had to try to find a new job. So like many people, I decided to go self-employment, and I decided to go down the health insurance broker because I wanted to continue helping people. And I thought this was another way that I could help a lot of people, just in a different way from what I was doing previously. And so I opened up my brokerage on July 5th after spending about 4 months at a captive agency, realizing that's not what I wanted to do. I didn't want to work for anybody, any agency, and so that's what I did. Just a few pictures of my family and kind of what I've done in the back, and some of my past pictures. There's some helicopter pictures, some SWAT pictures. I had to put a wedding picture in there to show my wife, and then we actually had a dress up during COVID. We were so bored that the family pulled out all the costumes, and we all dressed up in different costumes and had dinner with some family. My daughter, she would be irate if I didn't put a bunch of pictures of her up here, so these are just some pictures of her. And then some pictures of my son. Running track, playing football here at Plano East, and then a couple pictures of the senior pictures. This is my contact information. You'll see it a couple times during the slides. But what makes me a little bit unique is, again, I'm a broker, so I don't have any obligation to any one carrier. These are just some of the carriers that I'm contracted with. I have actually over 30 different carriers now, both on the private health insurance side as well as the marketplace. So I truly want to be able to help as many people as possible. Being contracted with all the above, I'm able to do that. So whether you're looking for more of a commercial insurance, your income can qualify you for a subsidy, I can help you in the marketplace. If you're looking for something more private, more customized, I can help you with private carriers as well. One of the big differences in what I offer comparably to just the marketplace solely is I have both underwritten and non-underwritten plans. These are just a couple of highlights of what the differences are. But what people don't really learn in high school when they should is what health insurance situation is probably best for them. There should be a class directly about health insurance and how to shop for health insurance and how to utilize it. For the most part, we just get health insurance through our employer and we just kind of follow suit and do what we think we're supposed to do. There are a lot of ways you can navigate your health insurance. Starting with what plan to pick for you. There's not a one-size-fits-all. As a broker, I schedule a call with you. We go through about a 60-second just discovery call. You tell me what you're looking for, all the way up down to your budget, what doctors you see, so that we can make sure that we correlate the network, how often you go to the doctor, how much you travel, and then we take all that into consideration, and I try to find a couple different options for you, and I'll present the options, usually virtually, and let you pick which plan fits you the best. The goal is to have a plan that you're actually happy with. Most people, statistically, are not real happy with their health insurance. They just have it because you have to have health insurance. You need to have health insurance. It's important. Some of the big differences with looking at underwritten versus underwritten, you can kind of see that sometimes the pros and cons are on both sides, which is not necessarily a bad thing. As far as underwritten plans, it's similar to life insurance. You have to qualify for an underwritten plan, so it's not built for everybody. Again, it's not a one-size-fits-all. It's designed for what we call relatively healthy people. So for the most part, most people qualify. About 90% of the population will qualify for an underwritten plan. But what makes them unique is generally they're a little bit more affordable. They're a lot more customizable. You can add supplements to kind of fill some of those gaps. And they're going to be more user-friendly. They're going to give you a little bit higher benefits a little bit earlier on. That's kind of how they're designed. There's some things called dollar-first benefits where the health insurance will actually pay before you pay anything. Downfalls is they're not made for everybody. So if you do have significant health conditions, that might not be the right plan for you, so we'll look at some other options that are out there. Other pros, there's no open enrollment periods. You can sign up for a private underwritten plan anytime during the year. You don't have to wait till open enrollment in November to sign up for health insurance. You're not in a contract with your health insurance. You can cancel anytime. You can sign up for a new plan anytime as long as you're going on that private side. The non-underwritten plans, they're more defined as the major medical plans, which was just a term that Obama created when he was in office. Those are generally your employer-based health insurances, the marketplace health insurance, traditionally kind of the carriers that you hear of, Blue Cross Blue Shields, as along with some of the new ones that come on the marketplace. Pros to these is they are very affordable if your employer is contributing to them, or if you qualify for a very high subsidy based on your income on the marketplace. So that might be a very good option for you. If you're self-employed and your income level outreaches that subsidy, these are not a good plan for you because they're not a good fit. They're very, very expensive to get to the point where they're actually a good plan. Downside to them, everybody qualifies. Anytime you have something where everybody can get it, you know that there's going to be something on the back end the insurance is going to do to protect themselves. Usually that is making the deductibles very, very high. That's how health insurances protect themselves. They have to be able to make money and protect themselves, so that's what they do, which then, ironically, healthy people never ever meet the deductible. It's very, very strategic how insurances set those up. Some other cons is you have to have open enrollment periods. So from November 15th to January 15th is open enrollment. So if you're looking for a marketplace plan, and that's when you're going to have to need to sign up unless you need one of the special enrollment periods. There's some qualifications for that. Generally speaking, especially in Texas, the marketplace plans have very, very small networks. They're not PPOs. You don't have the flexibility to see the doctors that you want where you might on some of the private plans. So again, these are some of the things that we're going to look at when we have that discovery call. You can kind of already see that there is not a one-size-fits-all. So shopping by yourself for health insurance is very difficult. It's very challenging. It's very frustrating, and it doesn't need to be. If you talk to somebody who's very well versed and very educated in this, we'll make the process much easier for you. I wanted to put a couple of educational things up here. So just some average costs for in-hospital medical expenses and what they're looking at. Again, the marketplace average deductible is $8,500. Only about 5% of people ever meet that in a calendar year. So the other 95% are just paying the monthly premium, they're paying their co-pays, and they're really paying for the people that meet that deductible. So that means health insurance is not really paying for anything for your health care. when you're shopping for health insurance, there's more than just getting the plan. There's so much after the fact that you can do to protect yourself just by being educated and having somebody that works on your behalf. For instance, if you're looking for coverage and you get a diagnostic test, did anybody know that it's 4 times more to get an MRI in a hospital than it is outside of a hospital? If you're paying for that out of your pocket, you're paying $2,500 for an MRI. If you look privately, you can get it as low as $300 and $400. Some of the private health insurance plans, again, pay first, so you may not pay anything for an MRI versus you go to a hospital to have that same test. Now you're paying up to $2,500 out of pocket. Those are things that I do for you as the client that you don't have to worry about. You can also get cash discounts with your health insurance, or through your health insurance a lot of times. Get reimbursed on some of the private plans. There are prescription discounts out there. There are different programs like GoodRx that I'll help advocate for. Health insurance on the marketplace generally has a copay where you pay $25 for a generic medication. GoodRx may charge $4 for that same medication. So again, use a broker. If you're looking for a really good one, I know one. And again, the broker doesn't have any obligation to the carrier. They don't care what health insurance plan you pick or what carrier you pick. They're looking to really help you. When it's all said and done, you're still going to have that information, and they're going to be there to answer all your customer service questions as well. And that's what I spend a lot of my time doing. I literally allot an hour every day just to customer service, whether that's following up on phone calls, helping them navigate and finding doctors, switching plans possibly, billing questions, claim questions, all of those things, even exploring ways to help save money. When I'm going through my Zoom with them, probably half of it is showing them ways to save money, not necessarily just on their health insurance, but on the day-to-day stuff as well. So you want to make sure that you have a plan that works for you. Let me help you do that. Good referrals for me, I won't just say anybody, but anybody who's self-employed is a great referral for me because again, they have to get their own health insurance. So anything from any other type of agent to brokers, plumbers, electricians, truck drivers, contractors, handymen, handywomen, etc. I can also help small and large businesses. If your family has an employer-based health insurance, but it's expensive to add the rest of the family to it, again, it might be a benefit to add them to a separate plan to get the most, to maximize the coverage and save the most amount of money monthly. And that is it. Any questions?
Very good. Now you can see, maybe talk to him after the meeting. Very good presentation, very thorough. I didn't say that front, but he did a great job nonetheless. I always encourage a little bit of background history about, personal, family, whatever kind of thing. He did a great job of that without me even mentioning it. So awesome job. Very good, very good.